Kids, adolescents, those are individuals that of course are growing. They get a series of injuries that are more specific to the fact that they're growing versus adults who have stopped growing. What kids will do is irritate or inflame or injure areas of the skeleton that are called growth centers. Growth centers are found all over the body, ankles, knees, hips, the spine, the shoulders. Anywhere there's a bone growing, we have these growth centers. In the knee, the most common growth center to irritate is right here, this black mark. This is an area of the shin bone, which is here, that grows, and the tendon, which is here, is the patellar tendon, attaches to the shin bone in that area. Traction from the tendon due to movement pulls on the growth center, and over time that can cause an injury and some inflammation in this growth center, and that produces pain. This is a foot and ankle, and same as the knee. This is a growth center in the heel bone, and it is the area where the Achilles tendon attaches to the heel. In children who are growing, this growth center is active growing bone, and injuries to this area will result in discomfort and pain coming from this growth center. The shoulder certainly is an area in hockey that is more likely to suffer a traumatic injury in a child versus an overuse injury, where we might see that in a swimmer, an adolescent or child swimmer. But traumatic injuries to the shoulder are pretty common in hockey. This area of the shoulder is called the rotator cuff. This is a group of tendons that connect these muscles into the ball of the shoulder. And we take these tendons away, we can see the ball or the head of the humerus, which is the arm bone. So these tendons envelop the top of the arm bone, and hence they're called a cuff, and specifically the rotator cuff. These are tendons that can become injured with trauma in hockey. In extreme cases, we can see fractures and breaks in the arm bone, and this is often a result of trauma to the shoulder. In the extreme case with these tendon injuries, sometimes we see tears, and we can even see them in adolescent individuals. Usually tears are reserved for older individuals where the tendons are a little more brittle and they're not as resilient as they used to be. But tears can certainly happen even in kids if the trauma is significant enough. Another injury we see in hockey players, and kids are no exception, is sometimes they'll dislocate the shoulder. So that's when the ball completely pops out of the socket and needs to be put back in, usually in the emergency department. So that's another issue we see in children due to traumatic injuries in hockey.